Good morning, everyone. Welcome back to the show. Bella Mars with me, Lane Daly. Today we are going to be delving into the topic of gout in detail. So I'd like to say a very good morning to our guest on set, Dr. Ravindran Ramachandran, consultant rheumatologist and internal medicine of Saimdabi Medical Center, Subang Jaya. Good morning, doctor. Welcome to the show.
Good morning. Thank you. Thanks for having me.
You know, every time I interview a doctor,
Sure.
you know, it's the energy level. You're so calm. You're so Zen-like. Is it something that you're trained to do in medical school?
I think it's all a show. We try to keep as calm as possible.
But actually inside, like
inside is all
heart palpitations and all that, is it?
palpitations and all that. We could collapse anytime, sort of feeling.
Wow. Okay. Anyway, okay, we're talking about, you're an expert. You're a rheumatologist,
Sure.
and basically you deal with concerns of the joints.
Diseases, yes.
Now, we hear the term gout so often. I mean, it's an illness that's been around ever since ever.
Sure.
Maybe you can give us a little brief description of what gout is.
Actually, gout is actually one of the more common joint diseases that worldwide. It's actually very common in this country. It afflicts about 2 to 3% of the population, which in this country is about 750,000 people.
Okay.
And why gout occurs is because there's a sudden buildup of a substance called uric acid in the blood. And uric acid is actually a byproduct of a breakdown of a protein substance called purine.
Okay.
And purine is actually commonly found in a lot of much loved food by all of us. You have your red meat, your ikan bilis, your peanuts, your seafoods. So what happens in gout is there's a sudden buildup of uric acid in your blood. You reach what we call a supersaturated level.
Okay.
The uric acid can't get excreted. It just suddenly starts depositing in different organs of the body. When it deposits in the joints, it causes joint swelling, and that's when we get our gouty arthritis.
I see.
It's important to note that uric acid also deposits in other organs, and the most critical being the kidney. That's why gout sufferers also get kidney damage and kidney stones.
Okay, because, you know, I mean, when we hear about, I mean, you know, as a lay person and you hear, you know, relatives or friends or whatever, you know, suffering from gout, you know, you don't take it super seriously. And it's just like, it's like the common flu, kind of, you know. But it is quite serious, isn't it?
It is a serious disease.
Could it cause death as well?
I think one of the main problems with gout is actually the blasé attitude towards the disease.
Yeah, I think that's the thing, the blasé attitude.
And I think it's probably one of the more undertreated diseases that we have. I think both a lot of gout sufferers tend to treat the symptoms rather than the cause. So most of them, when they have an acute attack, they take some medicines, the attack abates, but they don't have a follow-up to find out the root cause of the condition. Why are they having recurrent attacks? The mainstay of treatment is actually making an attempt to reduce the uric acid in your body.
So it's primarily caused by food then?
Yes. I mean, yes and no. A lot of us take a high purine diet and we never ever get gout. The problem in gout sufferers is they fall into two categories. 90% of them are unable to excrete uric acid in the urine. About 10% of them overproduce uric acid.
Okay, why aren't they able to excrete the uric acid?
That is actually basically a genetic abnormality. They do not have a particular enzyme that either transports the uric acid into the urine or particular enzymes that actually breaks down uric acid to an inactive substance.
Okay.
So that's why in a lot of patients with gout, you have a strong family history because it's a hereditary, a genetic abnormality.
Right, so it's hereditary then. Okay, now I understand that gout is more common in men as opposed to in women. Why is that?
I think there are a few reasons for that. The most gout is actually more common in men in their 30s to 50s. Women are relatively protected until menopause because estrogen actually helps to excrete the uric acid in the urine. So it's very rare to get a woman getting gout below the age of 50.
Because of our estrogen levels.
Estrogen levels, estrogen levels. Men, on the other hand, I think other reasons being that men tend to binge eat and binge drink a bit more. They tend to take diseases less seriously maybe and seek treatment a bit late. So I think that is the main thing. The treatment should be started early in gout.
But you know, I mean, it's human nature and it's life where, you know, men in their 20s, I mean, we're focusing more on men here because it's a disease more common for the male species. You know, they eat anything they want, they drink anything they want because they're in your 20s, you know, you're invincible, nothing happens to you.
Absolutely.
So, you know, don't you think it's very, very difficult to curb all that in your 20s where life is beginning and you have the money to go and splurge on dinners and food and drink and all that. And then when you're 30, you're, uh-oh, what's going on here?
That's right. But I think that's where I think health education is important. And I think when you have, when you know your uric acid levels are high or you have a family member who has high uric acid, I think that's when we should take notice and make the attempt to actually curb our lifestyle.
Just be aware.
Be aware of the disease because up to 80% of attacks can be abated just on diet control alone. And if you control your diet, you take care of your lifestyle at the early stage, you may not even require medication.
You know, most of the doctors we have on set here talking about any subject, they say the food is the most important thing. But you know, as Malaysians, you know, we love our food and we eat
almost everything.
Anything under the sun.
Absolutely.
You know, how are we going to, or rather, you know, as the medical fraternity, doing anything to actually curb or you know, raise awareness about eating healthy? I think a lot of Malaysians, we still don't.
I think that's an issue because I think both in the public and private sector, healthcare, we have actually emphasized, spent a lot of money, did a lot of publicity on healthy eating. The problem about promotion on healthy eating is very generalized. So my patients come and tell me, doctor, you tell me not to eat this, not to eat that, what can I eat? So I always...
people say, life too short, do whatever you want, you know?
So I only tell my patients who have gout, I said, you must actually try to avoid the big ticket items. So I tell them, avoid, restrict. And if you have gout, it's best to avoid sardines, very high in uric acid.
Really?
Ikan bilis, anchovies, internal organs, red meat, shrimp. So try to totally avoid all of this.
Has it got to do with a lot of cholesterol in these foods as well?
Not only cholesterol. Cholesterol is one thing. They contain a lot of purine, which is the protein that actually is broken down into uric acid in the body. Apart from avoiding all this, restrict certain food. You should restrict peanuts, restrict other types of seafood, and certain vegetables. People are not aware. They think vegetables are healthy. They can eat any sort of vegetables, but gout sufferers are advised to not to eat cauliflower, spinach, asparagus, and lentils.
Wow, I didn't know all this. And how would you know that, you know, it's a particular type of food? Like, I've heard, like, friends or even my dad has gout, and, you know, we don't really know whether it's caused by whether it's the red meat or we don't know whether it's the red wine. I think red wine also has a
alcohol, especially binge drinking, is one of the contributors to an acute gout attack. Unfortunately, due to social and work requirements, sometimes it's not easy to avoid alcohol. So as a general advice, the most at risk is beer. So if possible, try to switch from beer to wine. I think that would be better, And you're right, you brought out an important point because not all gout sufferers get gout attacks with all the food items I mentioned before. I have patients who actually eat how much peanuts they have, and they have no problems at all. Some of them, they take a bit of kuah kacang with their satay, next morning they have an acute gout attack. What happens in these patients is you learn over time to know which food can or cannot be
taken. That's learning the hard way.
Learning the hard way. Unfortunately, sometimes that.
Are there any tests or anything you can do to find out whether it's a blood test or, you know,
no, the blood test. In the blood test to see which food to avoid, not to avoid. When it comes to gout, we don't do that. It's actually not available, not possible. And I think generally, if possible, try to avoid the items I've mentioned before, because you have to remember that a lot of patients have high uric acid. They worry about their gout. But you also have to worry about your kidneys and your kidney stones, which are more silent conditions that can suddenly come up.
I can just imagine our audience out there. So what do we eat then? Anyway, we're going to be taking a very short break. We're going to be coming back with you. Maybe you can tell us a bit more about how to cure it or how to curb it and all that kind of stuff. But we're going to be opening our phone lines after the break. So do give us a buzz at 55690349 and we'll be happy to answer any of your questions you may have. Hey everyone, welcome back to Bella Mars. We are talking today about gout. And we have here Dr. Ravindran Ramachandran, who's a consultant rheumatologist in internal medicine of Sime Darby Medical Center here with us. Now, we're also opening our phone lines. I teased that before the break, so do call us at 55690349. Also, later on, maybe in about 10 minutes, we're going to be crossing over to Daphne Iking, who's in Sri Pentas and who will be sharing with us and where she's actually indulging in a lot of like really yummy, over-indulging food. Now, speaking about these rich foods that we eat a lot as Malaysians, do you find that in Malaysia, Doctor, that gout is more apparent than in other countries because of the kind of food that we have, you know, the rich coconut milk and all that kind of yummy super stuff?
I think the incidence of gout, the prevalence of gout is, I suppose, about the same all over the world. I think the incidence, the number of cases have actually increased the past 20 years. Previously, I think days gone by, gout was actually thought to be a rich man's disease because all the rich food were only accessible to the wealthy.
That's right.
But now your lobsters, your red meat, your steaks and all that are accessible to everybody. And I think over the years, unfortunately, our dietary habits have also not improved. So I think a combination of both factors have actually increased the number of gout sufferers in this country.
Okay, I think we've got a caller. We'd like to say good morning to Tony from Penang.
Morning, doctor.
Good morning.
Can I ask a question?
Sure.
I have a high uric acid, but I have no gout.
Sure.
So my level is around 550.
Okay.
Should I take medicine?
Tony, I just want to ask, how young are you?
I'm 40 plus.
I think, do you have kidney stones?
No, nothing.
Okay. I think the first step, normally you are at the first stage of gout, which is what we call asymptomatic hyperuricemia, where you only have high uric acid in the blood. You're fairly young. I think the first step would be attempting to control your diet as much as possible. Talk to your doctor. You must have a treatment plan. You must have a target level of uric acid to reach. Normally, I set the target for my patients of 340 micromoles per liter. You mentioned yours was in excess of 500. Why we reach that target is below that level, your uric acid cannot crystallize. So it will always be in soluble form, and that potentially will prevent you from having an attack. So please sit down with your doctor, set targets, give yourself a time frame, maybe 6 months, see how well you do, and if you don't achieve that target level, then maybe you would want to consider medication.
I hope you got that, Tony.
Okay,
thank you.
Thank you. Bye.
Thank you so much for calling. Okay, so basically, if a person has uric acid of a certain level, and whether or not he or she has gout, it should be lowered down.
It should be lowered down. It should be lowered down.
So how would you measure the uric acid?
The uric acid is measured in the blood. So we have a blood measurement. The normal range would be somewhere around 420. And generally, most patients like Tony, who do not have any symptoms of gout, symptoms of high uric acid, either whether be it gout or kidney stones, we normally advise dietary abstinence first.
Okay.
And a lot of them are able to get away with dietary abstinence, and that saves them from actually needing medication.
Right. So once you actually start controlling your diet and being very careful about what you eat, the level will drop?
Will drop. Yes, it will.
Okay. And it will drop, and could the person have a normal level of uric acid again?
They may be able to achieve a normal level. Most of them have what we call a slightly upper limit of normal levels, which is acceptable. to actually achieve a normal level, the level of dietary abstinence you have to make is probably not, unless you're a monk, I think that's not probably, not really possible.
We try lah. Dugaan.
Yeah.
Okay, we've got another caller. We've got Emmy from Puchong. Good morning, Emmy.
Good morning.
Hi.
Hi, good morning. And my name is Annie. Okay, I would like to speak to doctor.
Sure, go ahead.
Hi, doctor.
Morning. Hi, good morning, Amy.
Okay, doctor, I don't have uric acid, but I have psoriasis.
Psoriasis, yes.
Arthritis.
Sure.
Yes.
Psoriatic arthritis is a different form of arthritic disease where you have your skin disease plus a percentage of patients do have psoriatic arthritis.
Thank you, Emmy.
Sure. Thank you.
Just put the phone.
Sure.
But she's watching this, I'm sure.
Sure.
Carry on.
Okay. Psoriatic patients who have psoriasis have higher levels of uric acid. That's because they have increased cell breakdown. But the type of arthritis that they suffer from is different from what we call gouty arthritis.
Okay.
The treatment is completely different. Completely different.
I see.
We normally encourage patients who have who have psoriasis to also control the uric acid because the uric acid is normally much higher, but the type of arthritis is different, the treatment is completely different.
Okay. Now, you know, we've heard of what causes it, and we've seen the pictures of, you know, people who have gout. So it targets on the feet area?
Yes, about 90% of gout, first-time gout attacks happen either in your big toe, your ankle, or your foot. Why that happens is, in theory, gout likes to crystallize in slightly colder environments. Okay, so the areas furthest from the heart, where the blood supply is slightly lacking, is less warmer, so it tends to happen first time over the feet. Then it progresses, uncontrolled, it progresses to your knee, and in most severe cases, that's when it actually afflicts your fingers, your wrists, your elbows.
Basically the joints.
The joints.
Okay, so how do we, what's the cure, or, you know, what are the medication people can take and stuff like that?
I think the treatment of gout actually depends on the stage of gout that you have. There are actually 3 stages of gout. The first is as what our first caller told us about, what we call asymptomatic high uric acid.
Okay.
Treatment at that stage is basically dietary abstinence and close monitoring of your uric acid. Unless your uric acid is very, very high and we are concerned that the risk of damage the kidneys due to high uric acid, then we would consider treatment.
Okay.
Stage 2 is the most common that we all hear about, is actually intermittent acute gout swelling. That means you may have a sudden attack of gout in either your toe or your foot. These attacks initially last maybe 6 months to a year once. If untreated, they become more frequent, intervals become shorter until they reach the 3rd stage, which is chronic gout. Chronic gout is when you have persistent, continuous swelling of your joints. Movements become difficult. That's when gout actually hardens and forms crystals that can deposit in many parts of your body, in your skin. That's what we call the tophi.
Okay. I think we've got one more caller. We've got William from Subang. Good morning, William.
Okay, I would like to ask a question. Okay, I checked my uric acid, the level is 9.6. The normal is 7 point something. Do you think that is a very critical condition? Actually, I take a regular exercise. I also try to control food, but it wouldn't help.
Okay, thank you, William.
Sure. I think when you actually exercise and you take the necessary dietary restrictions and your uric acid doesn't come down, then it's very likely that this is one of the hereditary overproducing conditions where the uric acid becomes high. And I think if you have actually done everything and attempt to actually reduce your uric acid and it doesn't help at that levels, you may want to actually consider treatment with medication to reduce your uric acid.
Right. So you mentioned the 3 stages of the illness itself. Now, what kind of medication or what kind of treatment are we talking about here?
I think the treatment is only started when you have an acute attack where one single joint, 2 single joints are swollen, painful. To abate the attack, the treatment is symptom relief. We give you an anti-inflammatory.
Okay.
Those are the normal painkillers that we're all familiar with.
Yep.
A lot of doctors also add on another medication called colchicine, which is specific for gout. It reduces inflammation. But these medications are only short-term. They are only given until the attack abates because they treat your symptoms and not the cause. The most important aspect of long-term treatment is medications to reduce your uric acid levels in the body.
Okay.
And this is the most common medication that we give to reduce uric acid, which is given to about 90 to 95% patients. All patients with gout is a medication called allopurinol, otherwise known as Xyluric, which is a generic name.
Okay.
The problem about treatment is a lot of patients take this medication for a short period of time. When they don't have attack, they stop.
Yeah.
But these medications should actually
be
continued, just as your medication for high blood pressure or for diabetes, they should be taken continuously.
Okay.
And it's actually very risky to stop your medication suddenly, because stopping a medication suddenly can itself exacerbate an attack and worsen your gout.
Okay.
And it's also important to note that a lot of patients with gout also have high cholesterol, high blood pressure, high diabetes. They fall into what we call people with the metabolic syndrome. And
because as you grow older, your metabolic rate drops.
But a lot of it is actually hereditary, and a lot of young people have this. And I think a lot of recent research has shown that, like diabetes, like high blood pressure, like high cholesterol, uric acid has become an independent risk factor for heart disease. So actually, there's a lot of benefits, not only to your joint, not only to kidneys, in actually bringing down your uric acid level.
Okay, so I hope you guys got that. I mean, you know, at the end of the day, it's, you know, prevention is better than cure. So I know if you're in your 20s and if you're just living the high life, you know, you got to stop and think a little because you don't want to be suffering when you're slightly older. Interesting. Anyway, we're going to be having you back on after this with our fitness coach to talk to us about how. Welcome back to Bellamaz. We are talking about the topic of gout, and we have with us rheumatologist Dr. Ravindran Ramachandran, and of course we have Lucius Chu, who is an assistant fitness manager of Celebrity Fitness Malaysia. Good morning.
Yes,
welcome to the show. Now, before I ask you about the particular kind of exercises, do gout patients, do they need to exercise, doctor?
They definitely need to exercise, and there's normally no restrictions the type of exercise they do unless they have chronic gout where they already have a damaged joints. They have all the other benefits of exercising is because unfortunately a lot of gout patients, because of this metabolic syndrome, as I mentioned before, are obese.
Okay.
And obesity has been shown to impede the excretion of uric acid from the body.
Okay.
So the exercises not only improve your joint function, it reduces your weight, and that in fact in turn reduces the uric acid in your body.
So you're saying that most people who have gout, they're obese?
Sure.
Oh, really?
Tend to be obese.
Not
all of them.
Yeah, because there are a lot of people I know with gout, they're not big at all, you know.
I think those are obese fall into the category of chronic, or where they have the metabolic syndrome, where they have the comorbidities. So reducing the weight, exercising actually helps in many aspects, not only the joint itself.
Okay, okay. So Lucius, do you have clients coming to the center and saying that, look, I have gout, I need to help combat this, help me out here with a personal trainer or certain exercises, certain classes that, you know, I can reduce the gout issue?
Yes, we do have clients, I have friends, even friends, who have this problem, but the issue being is that...
You mean your friends your age?
No, he's 12 years old.
Oh, okay. Because I was like, you look like you're like 20 years old. How your friends all got... Okay, never mind. Anyway,
you'll be surprised.
I was giving you a compliment. You look very young. So yes, you do have, so carry on with that.
All right, so with the clients that I meet, is that when they already have a gout problem, normally when they come in, some of them already had attacks. Some, they come in because during their last body checkup, their uric acid raised the flag. So they decide, okay, it's time to make a change.
Okay.
Okay, so what I recommend, it really depends. Like what doctor said is that there are a few stages where some who have experienced some attacks before, I would usually see what their doctor says first. We really need to work closely with the doctors first, in the first place. For example, some of them, they go with personal trainers, some not. Like those who don't go for with personal trainers, I would usually recommend them to join a class like in Celebrity Fitness. We have yoga classes, aerobic classes. If I see they are not, like you said, some of the people you know, they're not obese or anything.
Yeah.
So they're not too much strain on the joints. So they can join maybe some line dance, yoga classes.
Light exercises,
yeah, light
basically.
Exercise. And even resistance training. The problem is that when people find that when they need to exercise, they find they needed to go, oh, come, let's go all out. We should be wetting the floor with our sweat and all that. Yeah, but
that would be ideal.
That would be ideal.
Yeah.
Yes.
But in cases such as this, maybe not so, right?
Yeah.
Okay, so you would recommend yoga or just good stretching and stuff like that?
Good stretching, even...
What about running and all that? Is that okay or not okay?
Really depends what stage they're at.
Okay.
Like if the chronic that doctor mentioned, running, I wouldn't recommend it per se. A lot of mobility work, like, okay, I'll ask you, when was the last time you just took your feet up and just rotated it like that?
Quite often for me. But I know a lot of people don't. I mean, I'm an exercise freak, so, you know, I do it. But for those who are not used to exercise, and a lot of Malaysians aren't, you know, we say we want to go, but the discipline and the motivation a bit susah there a bit. So you would really advocate and recommend them to move a little bit.
Yes.
Right?
Yeah. Start somewhere. Start somewhere. Just if you're comfortable at home, it's good. A lot of people, they try to pull off YouTube, pull off internet.
Yeah.
But it's without supervision, so it's about a bit, I would say, risky in that sense.
Okay.
Like gout patients, if you irritate the joint some more, it causes inflammation. And you actually trigger an attack instead of preventing one.
Is that right, doctor? You would trigger an attack if you're not...
I think the important thing is to realize that a lot of patients, when they have disease, not only gout, any joint disease, they are afraid that whatever exercise you will damage the joint.
I see.
But it's actually very important to realize that when patients have high uric acid or they have intermittent gout attacks, in between their gout attacks, their joints are perfectly normal. The joint is inflamed, it's not damaged. And when the joints are back to normal, they can do exercise as any other person. Only when they have an acute gout attack, when the joint is swollen, moving or irritating the joint can worsen an attack. That is the time where they need to rest, take it easy, take treatment to reduce the swelling, do some light exercises, as Lucius has said, as mentioned. Once they recover, they can actually step up the exercises they do.
Okay, okay. Now, gout patient or not, you know, a lot of people, they give the excuse that there's no time to exercise. If you ask me personally, I think it should be inbuilt in everyone's lifestyle every day. But if, let's say, they're really crazy busy in the office or something where there's no avenue, to, you know, to exercise, you know, or to, you know, go for lunch and then go and exercise and all that kind of stuff, what would you recommend? What kind of exercises would you recommend them to do in the office per se?
I would just advise them, most people, they sit in the office for perhaps they only come out of the seats during toilet breaks, something like that.
Yeah.
Just, okay, like when we're sitting upright like this, just take maybe 3 minutes off your time and just stand up straight, sit back down for maybe 10 times, 5 times a day.
Yeah.
It helps to a certain extent.
Okay, I know what's going through the minds of you guys out there. Pelik lah, nanti boss think we're all going psycho or something. No, no. But you know, you just go to a corner or something, and this will help, you know, in the long run at the end of the day, right? So, you know, you either want to be malu about exercising, or do you want to actually have a healthier body? That's important. So sitting up, getting down, you know, maybe like what you said, the rotation of ankles and wrists and joints.
Sure.
Do you work out, doctor? I'm curious.
What do you think?
I don't know.
I try to.
Okay, you look very zen. Are you a yoga kind of guy?
No, not really. Not really. Also, no time to exercise, but no excuse, but I try to as much as possible.
Okay, okay. So, so it's okay. I mean, the bottom line is, so it's okay for people to have gout, to exercise. It doesn't mean that, you know, you sakit joints. Maybe it can lighten the pain as well, isn't it?
Sure.
Lucius, have you had clients say, oh, after a workout, I feel much better than I initially came here an hour ago?
Okay, some of them, like one particularly, he had gout attacks and he came in still having gout attacks, intermittent. However, after the exercise, he found that his movement is easier because when he had the gout attack previously, before engaging with a trainer or fitness per se, before he came to Celebrity Fitness, he just stayed home and he just said, oh, I better not move. So it's actually quite a vicious cycle when the gout attack happens.
Yeah.
So they try not to move and it actually accumulates.
But
so,
must move, lah, right?
You have to. I think there's a fear of moving or fear of irritating or damaging or causing the gout to attack to become worse, but this is unfounded fear. They have to move because the more you don't move, as Lucius has said, muscles become weaker.
Okay.
And moving up, then trying to actually mobilize after that becomes much more difficult.
Okay. Thank you very much. Unfortunately, we're running out of time for this blog, but thank you, Doctor, for for being here on set with us, and thank you, Lucius, for the insight. We're going to be taking another short break, but when we come back, I'm going to be making some